Hello, everybody. I'm Dr. Catherine Zagoni, and welcome to the Global Fertility Summit, How to Get Pregnant Even If You've Tried Everything, and what you can do before conceiving to ensure that your baby has the healthiest, happiest life possible. I have an amazing expert with me today. Dr. Aumatma is a naturopathic doctor with a master's in nutrition who has been practicing medicine for 10 years. She's the founder of the Holistic Fertility Center, a full-spectrum holistic wellness center for fertility, hormones, and more. She and the center's other practitioners collectively serve clients locally and internationally. How cool. Dr. Aumatma was awarded the Best Alternative Medicine Practitioner Award in 2005. Congratulations. And she is a sought-out speaker on topics of fertility, women's health, and women's empowerment, as well as the author of her upcoming book, Fertility Secrets, What Your Doctor Didn't Tell You About Baby Making. She's also a very dear friend of mine, and I am so honored and just thrilled to have her here because she is a soul sister. She is a fertility goddess, and she is a brilliant, brilliant doctor. Dr. Aumatma, welcome. Thank you so much for being here today.
Thanks so much for having me. I'm really excited to be here.
Yay. So why don't we start with how you even got into fertility?
Yeah, that's a great little story. It was probably about 5 or 6 years ago I was with someone that I didn't see myself having children with. And as I was getting closer and closer to that magical age 35, where my ovaries were going to stop working and I was no longer going to be able to have babies, I started thinking about, like, what am I going to do? Am I going to have a child with this man that I don't really want to have a child with, or am I going to figure something else out? And that question kind of led me down this path of trying to figure out what other options were there? What else were people saying? Like, where were the other people, the natural experts that were saying something different than what Western medicine was saying? And I really couldn't find an answer. It was pretty much that magically at 35 our fertility declines, and that was going to be the end of my baby making. And it freaked me out. And then I read somewhere, it is Dr. Women's Bodies, Women's Wisdom, Dr. Northrup's book. And in her fertility chapter, she talks about, like, where is this coming from? Like, we have this idea in Western medicine that fertility magically declines, and yet there are people in lots of different parts of the world that have babies at 60. Yeah. So I was like, that's interesting. Like, I don't necessarily want to wait till I'm 60, but I would definitely like to know what it is that we're doing differently, or why we have this, like, pre-programmed belief system that we have a magical decline. And what it led me down was like asking different questions. So really getting to, like, what are the root causes of infertility? And if we know the root causes, then we can do as much prevention as possible. So then we can empower women to have babies later if that's what they're choosing. Or we can use it to treat fertility from a different perspective and really bringing that, like, holistic sense of conception and fertility, and like helping to get to those root causes was really the kicker for me. So after that, I was like, okay, well, let's try it and see if this works. And some of my first patients were the guinea pigs. Definitely, they knew they were. I did authentically tell them that they were going to be guinea pigs, and that all of this was theory, and I wasn't really sure it was going to work. But sure enough, like, within 3 or 4 months, people were coming back like, "Oh, I'm pregnant. Oh, I'm pregnant." And that's when I was like, okay, well, maybe there is something to this whole natural medicine thing. And maybe we have, like, both of us, you know, like, we have these amazing natural medicine tools and gifts that need to be shared with the world. So yeah, that's how I got into fertility.
Awesome. Amazing. I had no idea that there are women who are 60 years old having babies out there. Praise them. Oh my goodness. Amazing. And what a beautiful journey that you can have more comfort and confidence and control around when and how you conceive. I love it. I love it. I love it. And we have such an important topic today. So we're talking about recurrent miscarriages and what you can do about it. So is this something you see a lot in practice?
I do. I would say maybe 50% of my infertility patients are actually people that report that they can get pregnant really easily, but they're not able to hold on to the pregnancy. Either they're miscarrying really early on, it's chemical pregnancy, or they are miscarrying like 6 to 8 weeks in, basically in the first trimester. And it's really traumatizing, right? Like, it's such an emotional journey even to get to the point of being able to conceive, and then to get 6 or 8 weeks into it and then have a miscarriage. It's just traumatic, so traumatic. And I feel like there's a lot that often, I think there's been a little bit of a shift more recently, like as I talk more and more about this topic, people are getting more aware of how miscarriage is infertility. Because initially, when I first started doing this work, people were like, oh, I don't have a problem getting pregnant. That's not my problem. So I won't get your help because I'm not having a problem conceiving. And I'm like, but it's the same problem. Like, there's different root causes for the miscarriages, but it's the same, like fertility and fecundity, that ability to get to a full-term pregnancy is interrelated, and it is at the core just as much of a fertility issue as anything else.
Absolutely. Because we don't just want to get pregnant. Like, we want the result. We want the healthy, happy baby.
Exactly. Exactly.
So you had mentioned root causes. What are some of the root causes of miscarriages?
So I think inflammation, which is a really generic term that gets thrown around a lot, right? But inflammation, I would say, is probably at the top of inability to have a baby to term. And then that inflammation can be manifest in a lot of different symptoms. So whether it's GI inflammation, so a lot of the bloating, diarrhea, constipation, like the whole host of GI symptoms that point to maybe there's something underlying that's not quite working as well as it should, is usually a pointer to me that maybe there's some other inflammation happening in the body. And then other forms of inflammation. So whether it's joint pains or eczema, psoriasis, the skin stuff, which, as naturopaths, it's like, well, that's gut stuff too.
Totally. It's all gut stuff, right?
When is it not gut stuff? And then in terms of other underlying causes, not enough progesterone, but I don't think that it's, I was just lecturing a little earlier, and we were talking a lot about progesterone and how it's when the egg is released, that corpus luteum, that shell of the egg, is really what's producing the progesterone in the body for the first 2 weeks. So if a woman doesn't have high enough progesterone, she's definitely going to miscarry. And a lot of times doctors are like, well, okay, the easy fix is just give them a whole bunch of progesterone. But if you take a step back and you realize that that egg was released from the shell, and the shell is what's making the progesterone, then my assumption is probably that shell and that egg is probably not as healthy as it could be if you don't have enough progesterone. Like, if it's not doing its job, there's probably something going on with that thing. So really focusing on, yes, we want to get higher levels of progesterone, but can we also help egg quality to be at its optimal state? And that brings in like levels of nutrients. Are you do you have the right nutrients in your body, and are you able to use them in the right way to give the optimal egg quality, which will then lead to higher levels of progesterone. So those two things. And then the third is the epigenetic stuff. Most people these days and ages, like MTHFR is a buzzword.
And we have all sorts of fun names for that gene.
So that gene, but then also like when women come to me and say, oh, I've had multiple miscarriages and I already know that I have the MTHFR gene, my question to them is like, okay, well, let's test a lot of the other genes then, because it's almost never isolated. Like a person that has MTHFR never just has MTHFR. It's a whole host of underlying things. So really doing the full panel of genetic tests and seeing if there is some sort of other genes that could be helped and supported with the nutrients that will support those pathways.
Very cool. With those genes, do you find that it's more like the methylation pathways or detox pathways or any trends that you see with those?
Yeah, it's usually the methylation pathways. I haven't found detox pathways as much of a problem. But the detox pathways play a role. I'm trying to remember. I think the detox pathways are more playing a role in women that not necessarily are having multiple miscarriages, but other infertility stuff. So,
like if you can't break down your estrogen and
right,
estrogen dominance, all that sort of fun stuff.
Yeah, exactly.
Ah, cool. And I absolutely love the connection between the progesterone deficiency indicating egg quality issues.
Mm-hmm.
What sorts of things, you said check for nutrients. I'm curious, both for like checking for nutrients and for the epigenetic pieces, what sorts of tests do you run for your patients?
SpectraCell and the 23andMe. So those are my two favorite tests. SpectraCell is great to help zone in on what nutrients are really necessary or missing for women to be able to have that optimal egg quality. So, basically I think there's probably like 6 to 7 antioxidants that are connected with helping support egg quality, but not every person needs all 7 of them. So it's kind of like, okay, well, should we try and figure out which one you should take, or should we just load you up on everything? And my approach is, if you can like simplify and tell the body exactly what you need and have a really specific signal, then it probably works better because you're not guessing. And I kind of found this out through trial and error. I had a few patients early on that I used to give things that research said were good, like here's your acetyl carnitine and glutathione and whatever. And they would come back and say like, okay, well, nothing's changing, like it's not working. And then we would do the SpectraCell analysis, and the nutrients I was giving them weren't the ones that they needed. So they would have normal levels of everything, and then it'd be like vitamin C. And I was like, oh shit, seriously? Are you serious?
I know, and some of those antioxidants are expensive. Like CoQ10 isn't cheap to just like throw at somebody.
Right, exactly. So doing the test really eliminates that guessing game of which nutrients do you need, but then we can really like say, oh, you're really deficient in these, and that can support egg quality in these ways, so let's give you that one.
Yeah.
Or a lot of times, like women that have inflammation will have low levels of vitamin E. So it's like, okay, well, vitamin E is a really big anti-inflammatory. We should probably load you up on that so that you can help decrease the inflammation, but then you'll also help support egg quality because it's an antioxidant as well.
Yeah, I love the individualized approach because I've had similar experience. Like, and there's all sorts of protocols out there. Like, take all of these things for egg quality. Here's a list of 10 things. Everything from like bee pollen to or royal jelly to
Royal jelly.
yeah. To the carnitine, and glutathione and all that fun stuff. And I wonder, like, if somebody doesn't need all those things and I'm throwing it at them, like, is it too much for the body? Because then they have to process it and digest it and all this stuff. So it's like, we think there's, maybe all these protocols out there and lists of things that research shows could be beneficial, but maybe they were just beneficial in the people who needed them. And that's the percentage that did well.
Exactly.
And, could you be harming yourself taking a ton of stuff you don't need and spend a lot of money on it? So I think that's why it's so important to work with doctors like ourselves, because we can actually I think this is why you probably have such great success rates, is because like you're giving the body exactly what it needs and what it's asking for.
Right. Exactly. And we're all about that individualization of care. So even like of the 3 things that I listed as the top things for miscarriages, someone might come in with a completely different issue. They might have PCOS, or they might have antibodies to their thyroid, or oh, you have a high level of TSH that never got treated, right? So there's so many other things that could be potentials for increasing miscarriage rates, but taking it as like, here are the top things that you can do for miscarriage, I just think that it's, not the best approach to. It's okay to try it, and sometimes it's okay to try it. Sometimes it's just not. Not okay to just try random things, because I think I had a patient earlier this week who was taking really high doses of Vitex, and she had heard that it was going to help her fertility. It's the magic fertility herb. And I'm like, okay, well, let's test your hormones. But when she came in, she's like, I started taking Vitex. I took it for about 4 months, and now I'm not having a period. I'm like, yeah, well, too much Vitex. Like, let's get you off the Vitex and see what happens. So it's like, it's really easy to get information on the internet, on Dr. Google, that hey, this is going to cure you. This is going to be the solution to your problem. But the truth is that if you're not looking at the full picture and really understanding and making sure that all of the different things that could be going on aren't happening in your case, then you're just throwing darts out that may not land.
Totally. So even with that individualized piece, are there some things that women can do or couples can do to prevent miscarriages?
Or
does it kind of come down to like both the safe and like maybe just like the anti-inflammatory piece, maybe not a ton of supplements, but living like an anti-inflammatory lifestyle is.
Yeah, I think I wanted to answer that question almost in 2 different ways. So
sorry, I jumped in.
No, it's okay. If someone hasn't had a miscarriage ever, and if that's not an issue for them, then yes, I think there are things that they could do to just have a healthier pregnancy. I would say probably like making sure that they're eating well, not eating things that are inflammatory, and making sure that they have enough like either omega-3s, fish, whether fish oil or flaxseed oil or hemp oil, whichever their option. But having enough fats in the diet, and potentially like doing a preconception detox before they even get pregnant. So doing all the like preparatory things that are going to help support their body to have general well function. And assuming that they haven't had a miscarriage previously, that should work. But if they have history of miscarriage, whether you have 1 or 3 or 10, at that point, I think it's just really important to work with a doctor and try and figure out why they're having a miscarriage. and get to the root of it faster, so that you're not going in that same loop of, oh, another miscarriage, oh, another miscarriage. And there's this like, I feel like it's similar. You've probably seen this with people that are going through IVF, and they think, oh, the next time's going to be different. It's the same thing with miscarriage. Oh, the next one's going to be different. Like, something's going to magically shift and I'm going to be able to, and that's great. Like, that happens for some people, but to assume that that's going to happen and like put all of your hopes and dreams on that to have a different outcome is putting a lot of pressure on yourself, right? It's like, it just feels so tragic to me. And I've had pregnant women that are in the middle of a miscarriage. Like, they're like, I'm having cramps, I'm bleeding, can you help stop it? And I'm like, I can try. Like, I don't know if it's gonna help, but like, you really should have come see me before you got pregnant, so that we could have set you up to not have this happen. And then I've had some women that call in the middle of that, and we save it with progesterone and some herbs, and it works out, and that's great too. But it's so stressful. I feel like it's so stressful to have had a miscarriage before and then to get pregnant again, knowing that you haven't done anything different and you're not sure why it happened, and your doctor says, well, the next time's going to be fine. Yeah. Which is usually what they tell them. Like, most OBs are like, well, one miscarriage is totally normal, just try again.
Yeah. Oh, well, I'm so glad there's so much out there resource-wise and hope-wise for all the couples who have had miscarriages.
Yeah.
Yeah. Because it is so devastating. And so I'm glad, I'm just glad, everybody, there's hope. There's so much hope. I haven't gotten anything else from all of these interviews. There's so much hope. Anything else on miscarriages that you want to mention before we transition to topic number 2?
No, I think we did a lot. I covered a lot.
Awesome. Yeah, we totally did. So then the other piece I wanted to talk about, because nobody else has talked about this yet on the summit, and I see it a lot, and it sounds like you see it a fair bit too, is couples who they've had baby number 1, and it's a year, 2, 3, sometimes 4 years down the line, and they want baby number 2 or baby number 3, and it's just not happening. Whether there's a miscarriage or not, there's some sort of infertility piece going on after they've already proved that they can do it. So tell me about what you see with what's going on there.
Well, I think there are a couple of things going on with baby number 2. And one is the healing that needs to happen post baby number 1, right? So I think that a lot of women forget that there is this 4th trimester. It's that 3-month period right after having a child that is really important to replenish, nourish, and nurture themselves while they're doing that for the baby. So I think that's the first thing, right? Is like, even, all right, let's say you've already had baby number 1 and you've waited 6, 7, 8, 10 months, whatever, still do that piece. Like, don't skip it, because it's so essential to our own, it's that like nurturing the mother as much as the child needs to be nurtured, because otherwise you're just depleting what's not there. You've given, as a mom, like as a pregnant woman, you gave everything you had, nutrients as well as energy, to this child to grow it inside of you. So if you don't do the replenishing, then you're pulling from an empty bucket or a very low bucket, and causing more depletion is part of it. The other thing I think is that potentially there's thyroid imbalances that get introduced either during pregnancy or after pregnancy that really impact whether or not that second child is going to be peaceful. So someone that may not have had a thyroid issue to begin with might end up having a thyroid issue after a child, which, if it goes under the radar, which, as you know, they often do, then it's not being covered, and there's like, it's not explained as to why they're not able to conceive. And then 3 is just the factor of age, right? So if you have depleted so much, then you add to it the stress of not being able to sleep for like almost a year, sometimes 18 months. And you don't have anything that's repaired your cortisol patterns, then you can almost guarantee that you've aged much faster in those last 3 years after having a child than prior to that. So the aging is happening way faster when you're more stressed out. You have way more on your plate, and you're already in a deficient mode. So how can you actually like function? How can you like make your body work? And it's going to work. You're going to feel like, well, I'm sustaining, but you're probably not feeling very vital, right? And if you can really support that vitality and get that vitality back sooner rather than later, then you have the ability to age more gracefully and not have those years impact you as much as they would otherwise. So really like having that aging happening faster then puts you in a more challenging, more difficult place to be able to conceive second or third, whichever it is.
Yeah. That's super helpful information. Thank you.
Yeah. You're welcome.
And again, hope. Just nourish yourself.
Yeah. Nourish, replenish.
Get your thyroid tested.
Right.
Sleep.
All good things.
Wonderful. And you have a very generous gift for our audience today. Can you tell us about that?
I do. It is called the Divas Detox Guide. And it is basically a lot of my work is around helping to rebalance hormones and all of that thing. But I feel like even a precursor to that is just making sure that you're not putting a bunch of estrogenic things onto your skin before you even walk out of the door in the morning. And most average women walk out of the house having put on 70 different toxins onto their body, all of which impact fertility, by the way. And all of them have this like effect on estrogen or progesterone or egg quality, or introducing toxins in the body that are going to deplete egg quality. So if you don't like, I feel like the first thing is to just get educated on what's around you and in you and on you, so that you don't keep repeating that stuff. And I feel like it's challenging. So a lot of the pushback that I would get from my patients were like, well, I'm not walking out of the house without makeup. So I was like, okay, fine. So I spent hours like collecting different companies that made clean makeup that were reliable. And just basically made a list of all the companies. So if you're listening and you're in the US, you can pretty much go and buy those products. If you're in other countries, then you may not have access to those products, in which case the other goal for that ebook was also to help educate on what to look for in terms of ingredients. So I've listed like sample ingredients of commercial things available. And then like highlighting things that are like not so good, or how, if you can just compare the labels. So if you're comparing mascara, for example, then you can say conventional mascara, non-toxic mascara, let me look at the ingredients, and you can go into any store and be empowered to like find the product that's less toxic.
Amazing. I love that. I love that.
Yeah.
Thank you for sharing that.
Yeah, you're welcome. So people can just download that. It's an ebook, and use it widely. Spread it around.
Share the love.
The toxins.
Share the love. Another doctor friend, I don't know if you know her, but she just posted on Facebook that she just got rid of all of her commercial lipsticks after seeing all the heavy metals coming back in her patients from mostly lipsticks, makeup, all that
Wow.
sort of stuff.
Yeah. Yeah. Heavy metals. Wow.
Yeah. I think lead was like the biggest one that was showing up in a lot of lipsticks.
Oh my gosh.
I know.
Okay. Yeah.
I know. Awesome. And so thank you for the gift. And I would love to hear what your like favorite success story right now.
Well, my favorite one is the most recent one. It's always the most recent one. It is, so I was working with this woman, 37 years old. She had been diagnosed with endometriosis, had been through one surgery, and was basically scheduled for her second surgery. She had tried 3 IVF cycles in between her first surgery and the time that I saw her. All of them unsuccessful. I think she had gotten pregnant naturally once and then miscarried. So there were like so many layers of what was happening for her. And then she had the whole host of digestive stuff. She had every symptom under the sun that pointed to gut inflammation. And then on top of all of that, you can add the emotional layers. So she basically was in the state of grief because she was 37 and couldn't get pregnant and had had a miscarriage once. And basically all the doctors were like, there's no way none of this is going to work for you. Your AMH is too low, your FSH is too high, your estrogen is high. We can't figure out what to do with you. So she came to me and I kind of like looked at all of her labs and was like, ooh, I don't know what I can do for you, girl. And she was like, well, you're kind of my last hope. So if you don't take me, I don't know what I'm going to do. And I was like, well, I'm okay to try. I just want to give you like really realistic expectations of what's possible. Like your hormones don't look great. I think her FSH was probably like 21. And her AMH was 0.48. So it was pretty much like her ovaries were starting to give out. She was technically in menopause, even though she was having regular cycles. She was stressed out. She lives in Sacramento and drives back and forth to the Bay like 3 or 4 times a week. So add all of those things in together. I was just like, I don't know what's possible here. Like endometriosis alone is hard to treat, let alone like all the other stuff you have going on. And she was like, well, I'm willing to do anything that you tell me to do. I promise I will do everything. And so we started working with her. I worked with her for about 6 months, I believe. Basically we went all the way up to her second surgery. And so she had the surgery and then her hormones had improved quite a bit. Her adrenals were better. Her digestion was better. She was absorbing her nutrients. So I was like, okay, it's time. Like, let's do the IVF cycle and see if there's a different outcome. And I just heard from her yesterday. She had her 6-week ultrasound and the baby's looking healthy. So. Yeah.
Oh, congratulations.
Yeah.
Congratulations. Oh,
thank you.
That's so wonderful. Thank you for all that you do in the world for women and couples and baby souls and everybody.
Yes. Thank you. Thank you for being my sister in that.
My pleasure. Any last words? Any last words before we conclude the interview today?
No, I think this was a lot of fun, and I love that you're doing this summit. I hope that it serves a lot of women who are needing support and needing help and needing hope.
Awesome. Dr. Aumatma, thank you so much for hanging out with me today. It was such a blast. And to all of our viewers, thank you so much for joining us. I can only imagine how much fun and hope you're having back there because I'm having a blast. Join us for our next interviews and we'll see you then.
All right.